Hello everyone. So I will be making a series today, which is called the Q&A series. On an average, I get a dozen to 2 dozen emails every week regarding questions on AMC and how to get a job in Australia as a doctor. And obviously some of those questions are quite repetitive, so rather than answering them one by one in emails, I have decided that I'll make a quick Q&A series, and this is going to be the part 1 of the Q&A series. I have actually made a couple of videos before answering these questions, and it has been very useful for people, so I will continue to do the same. And today's question that I'm going to answer is about general registration in Australia, so keep tuned for it. Raise your hands. Alright, so today's email is, "Good day sir, I have been watching your videos for international doctors coming to Australia. You have been an inspiration for many doctors wanting to move to Australia. Thank you. Sir, if you get time, can you please answer some of my questions? Number 1, is passing AMC2 clinical exam absolutely mandatory to get general registration via standard pathway, or is there a substitute for it?" So, given there are multiple questions in this email, I will answer them one by one. So your first question is that is clinical exam absolutely mandatory to get general registration, or is there a substitute for it? The answer to that is no, it's not absolutely mandatory to get general registration and have the clinical exam. You can do something like what I did, is do the WBA program. I will make a separate video on what is a WBA program, but it's essentially a 1-year program that you do in accredited Australian hospitals and do 24 assessments during that 1 year. And if you pass them, then you are exempted from the clinical exam. And essentially what that does is substitutes the clinical exam for you, and then you can get general registration. So hope that answers the first question. Second question is it possible to get general registration if you have clinical gaps after your graduation? So the simple answer to that is absolutely yes, it's possible. A longer answer to that is depends on how much clinical gap you've had. According to AHPRA's guidelines on recency of practice, in order for you not to have been considered as having a gap, is practice of 3 months in the last 3 years as a doctor in a paid role, or practice of 1 month in the last 12 months as a doctor in a paid role. As long as you have either or of them, it is not considered a significant clinical gap, and you should be able to get your general registration. I'll put a link down in the description or a screenshot of the recency of practice. The third question is, does having a PR in Australia have any advantage of you when you are applying for a job for registration via standard pathway? Simple answer to that is absolutely yes. It's a huge advantage having a permanent residency, and there are several ways in the way it is an advantage. The first one being the rule in Australia that anyone who has permanent residency or citizenship in Australia needs to be given any job that is advertised first, as compared to giving it to an international or somebody who doesn't have the permanent residency. So it's like criteria. So if 2 equal candidates come for a job, then the candidate that will get a preference is the one who has permanent residency or citizenship in Australia. When it comes to permanent residency or citizenship, they actually hold a similar weight, so there is not much difference. So the answer to that is absolutely yes. The second reason why it is easier to get job with permanent residency is, or PR as they say it, is because the hospitals don't have to sponsor you for a visa, and sponsorship of the visa is a complicated process. It costs the hospital some money, and it can take time, and hospitals do not want to get into that hassle of extra paperwork and things that come along with that. Okay, fourth question. Do you require work experience after MBBS to get a job after AMC 1 CAT exam in Australia? Okay, this is an important question, and I have previously answered this in my previous videos on how to get a job in Australia. However, I will retouch on that. Essentially, to get a junior doctor job in Australia, there are two main categories. So number one is an intern, and number two is a resident medical officer, or as a junior medical officer / HMO or hospital medical officer. So intern positions are very difficult to get. If you don't have any experience, you're only eligible for intern positions. Whereas the resident medical officer positions, which start from PGY2, which is postgraduate year 2, to PGY 4 and 5, to postgraduate year 4 and 5, are plenty of jobs. So it's always easier to get a position if you have at least internship experience in Australia, or if you have 2 or 3 years of experience from your home country, then it's even better. It increases your job prospects. The last part of the question is just to complement. The answers to these questions will be really helpful for planning my Australian journey. I'm an intern in India. I guess you should finish your internship in India if you're there at the moment, and then try for jobs, because that will increase your chances of coming to Australia. I hope that has answered all the questions, and keep sending me your emails. I receive at least a dozen emails a week. I try to respond to all of them. I have decided now that I will try to make videos for the emails, because some of the questions are repetitive. So if I have a video, you can just refer back to my video, and that should answer most of the queries for you. So thank you. And if you like the content that I'm making, please share and subscribe to my channel. That helps in supporting the content. And if you want mentorship in getting into the Australian system, especially in terms of how to navigate the system and get a job, I do offer mentoring services for those who want step-by-step guidance. So I'll put the link down in the description for you. All right. Thank you very much. Bye.